And he's going to be talking to us today about arm injuries, which is obviously an important thing here with baseball guys. So at this time, I'll turn it over to Dr. Mazaway.
So I'm going to go ahead and introduce myself a little bit here. So again, Chris Maz, I'm an associate professor at the University of South Carolina. We're going to talk a lot about South Carolina and some of their athletes, and I apologize for Clemson fans and all that. Just I work with South Carolina, that's my experience. And so don't get a chance to operate on a lot of Clemson people. Operate on Coastal Carolina, USC Soccer, Sakahachi, Aiken, Coastal or College of Charleston, all those guys. So again, there will be a little bit of a USC bend here. They do write the checks. So I was a high school baseball player. That was me on the left. Was a really good catcher. I was about the worst hitter you could ever imagine in high school baseball. But baseball was my love. Absolutely loved baseball. My dream was to go play for Stanford. That didn't quite work out for me. So I decided to go play football at Cornell. So played football in the Ivy League, won a couple Ivy League championships. But baseball was my love, and I wanted to pursue that. And so became an orthopedic surgeon, wound up doing a fellowship with this guy, Bill, Dr. James Andrews, who most of you probably heard of. So I spent one of the best years of my life learning from him. And then came to South Carolina, and I was very, very fortunate that about 6 or 7 years ago, I was asked to take care of the baseball team. So I had a couple of national championships, a couple of rings, a couple of SEC rings, and so it's been a wonderful ride. First thing I want to say is thank you. Explain this. So this is my dad right here. This is probably back in 1976. My dad was a high school biology teacher and a high school coach, and wound up having 3 kids. I'm the oldest, and didn't make enough money teaching and coaching, and so he had to give that up. And when he had to give that up, it broke his heart. And so I want to say thank you in that I understand how hard it is sometimes. None of you guys get paid enough money for what you're doing. And so I recognize the sacrifice that goes along with that. The next thing is this guy right here. So this is Fred Krenrich. So he was my coach when I was in 6th, 7th, and 8th grade in school. Fred Krenrich got me through medical school and through residency. When I was in medical school, things were getting rough. When I was in residency, things were getting rough. I thought of him. He woke up every day at 3:30 in the morning, folded papers, went and delivered newspapers, taught all day, then he coached until about 6 or 7 o'clock at night. And went home, took care of his family, and did the same thing. And so when I realized when things might be getting tough for me, I came back to that man. And so I say thank you, and that you guys have a tremendous amount of responsibility. It's not winning games, it's taking care of kids and turning them into men. So thank you for that. That's certainly recognized. All right, so what we're going to talk about is a little bit of introduction to the baseball throw, shoulder injuries in baseball, elbow injuries in baseball, little biomechanics, causes of injury, injury prevention. Okay, there's a lot that I'm going to talk about. We can go through days talking about all the stuff that I'm going to talk about. Okay, what I want you to do is introduce you to a little bit of anatomy, the injuries that we deal with, and then again talk about biomechanics associated with that and how we can prevent it. So you guys all know throwing a baseball puts a lot of stress on the tissues, okay? Especially the shoulder, especially the elbow. Huge amount of stress is when you're throwing a baseball. It's unlike almost any other action you do in sports, okay? Throwing a baseball is the fastest known movement in sports that we know of, okay? So a huge amount of stresses that we put on the shoulder and elbow. Now, some of those stresses are necessary. Okay, you can't build muscle unless you stress the muscle. Okay, you can't loosen up the shoulder and get that rotation that you need unless you stress that shoulder when you're 10, 11, 12, 13 years old. Okay, so some stresses are necessary, and we need them. They're necessary to become a better baseball player, but if there's too much stress, it leads to injury, and that's certainly not what we're looking for. So the thrower's paradox. In the shoulder, there's this tremendous balance between mobility and stability. Okay, and so what I mean is when you think about the shoulder, the ball and socket joint, that ball is really happy when it's centered right there. Okay, it needs to be centered in the socket. Okay, but you need to have a lot of rotation when you're throwing a baseball. So that shoulder, when it's rotating around, it needs to stay centered in the socket. But the forces you're putting on the shoulder when you get into external rotation and internal rotation want to pull that ball out of the socket. And it's not happy. That's not a happy shoulder. And so a lot of what we're going to talk about, injuries and biomechanics, are the forces that are necessary to hold that ball centered in the socket. So just an example of some of the forces when you're throwing a baseball. When you're cocked back in this throwing position, abduction, external rotation, okay, you're putting 1/2 of your body weight stress through your shoulder. Okay. When you release the ball, remember Newton's laws, inertia, things want to keep moving in the direction that you put them in. When you release a baseball, the forces in your shoulder wanting to pull that out are 1 times your body weight. So for me, it's 200 pounds of force that's wanting to pull that ball out of the socket. So things have to counteract that to help that ball stay in the socket. And the things that counteract that are the capsule of the shoulder and the rotator cuff of the shoulder. And again, we'll talk about that, and it's associated with injuries. So just an example of the velocities that you're generating when you're throwing a baseball. Okay? When you're going from external rotation to internal rotation, you're developing your acceleration is 7,000 degrees per second. So what that means is if you allow the arm to keep going, it would go around 19.4 revolutions in 1 second. So fastest known motion in sports. And that motion happens in a hundredth of seconds when you're going from external rotation to ball release. Okay? So there's big rotational forces in the shoulder when you're throwing a baseball. And again, that's associated with stress throwing a baseball. Let's talk about the shoulder. Keep going. Keep going. All right. So you can get, keep going. You can, that's good. Okay. So you get injury to the bone. So when we're thinking about a shoulder, you can get injury to the bone. You can get injury to the cartilage. You can get injury to something called the labrum, and I'll show you what that is in a second. You can get injury to the capsule and the ligaments of the shoulder. You certainly can get muscle and tendon injuries. That could be the biceps muscle. It could be the rotator cuff muscles. It could be the pectoralis major muscle. It could be the latissimus dorsi muscle. Okay, all those things can get injured in the throwing shoulder. Nerves can get injured in the throwing shoulder. And blood vessels can get injured in the throwing shoulder. So all of these things are injuries that we see and deal with in the throwing shoulder. All right. One of the things, go back. Go back. Go back. There you go. All right. One of the things that's really, really important in the concept that I need you guys to understand with the shoulder is the importance of this bone. Okay? The wing bone, the scapula. Okay, that's this bone right here. Okay? Again, I'm going to refer a lot to the ball and socket. The socket is attached to this bone, the scapula. Okay? And I've talked about the importance of that ball staying centered in the socket. Well, in order for that ball to stay centered in that socket can't move. If that socket's moving, then you're in big trouble because it's hard to hold that ball centered in the socket. Okay? So there's a lot of injuries that can occur to the scapula. It's something called scapular dyskinesia. And a lot of the exercises that we do, that your athletic trainers are doing and physical therapists are doing, are really centered on holding that wing bone in place. Because a lot of times, especially in pitchers, that wing bone will want to come out. And that causes a lot of problems in the shoulder. There's 17 muscles that are attached to that bone. And they all need to be working well when you're throwing a baseball. This is what happens if you get something called scapular dyskinesia. This is a pitcher where that scapula sticks out. If that scapula sticks out, that socket's moving, and then it's really hard to keep that ball centered in the socket. All right, so this is the rotator cuff. We've all heard of the rotator cuff. Set of 4 muscles that surround the shoulder. There's one in the front right here. There's one on the top right here, and there's 2 in the back. Okay? This is the most common site of injury in baseball players, right there. Okay? It's kind of the superior posterior rotator cuff. Right? The vast majority of injuries in baseball pitchers, and I'm talking about pitchers in general, because the ones that see the most injuries. These happen with all the throwers, but we'll focus on pitchers primarily. So this is where these injuries occur to the rotator cuff. There's also the capsule around the shoulder. So this is looking directly in the socket. You've got the capsule around the shoulder. You've got the cartilage there in the center of the socket. And around the socket, there's this tissue called the labrum. Really, really important when you talk about a throwing shoulder. Right. There's also the biceps. Okay, so your biceps muscle comes up and forms a tendon that runs in this groove right in the front of the shoulder right there. And that biceps muscle comes in and attaches to that labrum. So this is a really good example of the labrum of the shoulder. There's a very specific injury that happens in overhead athletes, okay, called a slap tear, S-L-A-P, slap tear. And that's an injury here where that biceps, when you're coming back and then you're releasing, that biceps yanks on the labrum, and over time it pulls that labrum off. And it causes a lot of pain and inflammation in the shoulder. And so one of the things we do surgically sometimes is we go and fix that labrum. We'll talk about that in a little bit. This is an example of what you see, that's that labrum, and that biceps yanks that labrum off and causes problems. So this is it. So this is looking at a cadaver. So this is the biceps, and this is that labrum that surrounds the shoulder. That labrum is attached to the capsule. Okay? And this is what it looks like arthroscopically. So this is the biceps coming down, and that's the labrum on the top. All right, so where do injuries occur in the throwing motion? Okay. The most common time when you injure your shoulder is at ball release and deceleration. Okay. And again, it's because of what we talked about earlier. So you're coming back, you're releasing the ball. That ball wants to fly out of the socket. That rotator cuff on the back of the shoulder has to hold that ball in the socket. And so it's posterior rotator cuff injury right there. Most common injury we see in baseball players. Second most common is right here. And I'll go over something called internal impingement. But that's that and right there are the two places where rotator cuffs or injuries occur in the throwing shoulder. This is where injuries to the elbow occur. And I'll show you that in a little bit. So there's this concept of something called internal impingement. I'm getting kind of in depth. You guys don't necessarily need to know this, but where it is when you're in this position of abduction, external rotation, that ball kind of wants to swing out of the socket a little bit, and the rotator cuff gets pinched in the back of the socket right there. Okay, the socket's called the glenoid. Gets pinched in the back of the socket, and that's where rotator cuff tears occur. So that's how they occur in the back, and it's when that ball, when your ball releases, where they occur. And this is what we see. This is a rotator cuff tear in the shoulder, and that's what we see from those injuries. There's nerve injuries that you can get. All right, then there's blood vessel injuries, okay? So you guys may know who this is. Jackie Bradley Jr. He was a freshman coming in, highly touted recruit. He's, I think it was maybe September or something like that. Wakes up one day, his arm's all swollen, completely swollen. Shoulder hurts, arm swollen. So he wound up having damage to a blood vessel right here, okay? So the cardiothoracic surgeon had to go in and take out a rib. Right? 4 months later, he's back playing baseball, and obviously he's done pretty well. So those are injuries that we see too, blood vessel injuries. All right, so injuries that we see in the throwing shoulder are rotator cuff strains and tendinitis and rotator cuff tears. This injury to the labrum called a slap tear, labral tears. Instability, okay, so what does that mean? So the capsule of the shoulder just is having problems holding that ball inside the socket. Okay, the capsule is loose. We tend to see that a little, obviously more in females and in males, softball players and things like that, but certainly can occur in baseball players. You actually get too much capsular tightness, and that happens in the back, and there's this process called GERD. And I'll discuss that in a second. Internal impingement, which we showed. Subchromial bursitis, that's what happens in old people, like me. Typically doesn't happen in baseball players. All right. You can get an injury to the cartilage, nerve injuries that we talked about, thoracic outlet syndrome. Most of it is associated with overuse and poor mechanics. We're going to talk a lot about overuse. We're going to talk about mechanics. Okay? And in some senses, you might feel like I'm blaming coaches if they don't feel that way at all. Okay? Or parents that they're not doing the right thing with their kids, or they're overusing their kids. And every injury results in overuse. It's not necessarily the case. Okay? There are parents who do wonderful things in keeping their kids from overuse. Coaches who do all the wonderful things, and kids just don't get hurt. Clearly, overuse is one of the major causes. In kids, so this is what we'll see in our kids. This is what we see in our kind of 8 to 12-year-old, 13-year-old kids. So there's a growth plate in the shoulder right here. And when we talked about the stresses to the shoulder, okay, and the fact that you need to throw. So when you're 8, 9, 10, 11, 12, you need to throw. Well, one of the reasons is that your body needs to adapt to throwing. And a cool thing happens. So when you're 10 years old, when you're throwing a baseball, you're putting stress with this growth plate, and the body actually adapts, and the ball of your throwing shoulder turns backwards compared to the other one. In order to be a good pitcher, you need to have that happen, because that allows you to get more external rotation, which allows you to put more force on the ball. Okay? So we need stress to that growth plate. Okay? But if you put too much stress, you get inflammation, and you get something called middle weak shoulder. And that's when kids need to sit out for 3 months or 6 months or so. Okay, so this is what happens with the throwing shoulder. It's this cycle of injury. So you get repetitive microtrauma. Talk about injury too. Whenever you go out and throw a baseball, you're tearing your rotator cuff. You're getting little bitty microscopic tears of your rotator cuff. You're getting little microscopic tears of that Tommy John ligament, that ulnar ligament. What happens is with proper rest and proper nutrition, the body heals itself. So you can go out the next day and create little tears. You go out the next day and create little tears. Those tears are occurring. If you don't give the body enough rest to allow it to heal itself, those little tears turn into a little bit bigger. Bigger tears turn into a little bit bigger. And that's when you start having injury. So with repetitive micro trauma, so you're throwing the ball every day, what happens is your tissues get fatigued, your muscles get tired. You get inflammation, pain, and then what happens is your muscles stop working. Okay? So again, that ball needs to stay centered in the socket. Your muscles get tired, those rotator cuff muscles get tired, that ball starts to fly around in the socket. Well, what has to happen in order to throw? Your muscles have to work a little bit harder to hold that ball inside the socket. And so you get more muscle fatigue. And then you get poor biomechanics. And so this cycle just continues. There's this concept of glenohumeral internal rotation deficit, which is basically where you get tightness of your shoulder, in the back of the shoulder. And so what we'll see on exam is we'll take a picture and we'll compare their throwing shoulder to their non-throwing shoulder. Okay. Like cool thing I talked about where you get the growth plate changes in your shoulder. If you take a picture, their throwing shoulder should be cocked backwards about 8 to 10 degrees compared to their non-throwing shoulder. So if you compare their ranges of motion, they should be different on their throwing shoulder than their non-throwing shoulder. But some pitchers will get tightness with internal rotation, so they'll be tight when you bring them down. Okay? And we know that that's associated with some injuries. There's a guy named Kurt Schilling, you've heard of him. So Kurt Schilling was pitching, and he developed shoulder pain. And he wound up going to a bunch of different doctors, and some wanted to operate, some didn't want to operate. And he ultimately wound up going to a doctor up in Boston who talked about his tight shoulder. And he had Kurt Schilling go through some simple stretching exercises, sleeper stretches that many of you have probably heard of. And about a month later, he was fine and doing great and avoided the surgery. Okay, so tight rotation is something that we think about too. So these are these stretches. These are these sleeper stretches that we talk about with pitchers. Okay, so that's important. Your athletic trainer and physical therapists need to know about tight posture capsule and those kind of things. All right, so how do throwing injuries occur in the shoulder? Overuse concept, posterior capsular tightness, or this thing called GERD. You get the slap lesions that I talked about, internal impingement, and instability. Okay, so all these things are likely playing a role in developing shoulder injuries. All right, so talk about MRIs. Okay, so coach, my best player's shoulder hurts. I hear at ESPN all these major league players get MRIs all the time. You need to get an MRI. MRIs are dangerous when you're talking about a throwing out. So this guy did a study. He looked at 14 completely asymptomatic professional pitchers, okay, where he got an MRI of both of their shoulders. 79% showed an abnormality on their MRI. Okay, so they had an injury pattern on their MRI. They were completely asymptomatic. They had no problems whatsoever with the shoulders. So Dr. Andrews looked at this, and he looked at 31 pitchers. 90% of them had abnormal cartilage, and 87% of them had abnormal rotator cuffs. Okay? We talked about the stress of the shoulder. If you throw a baseball, you will damage your shoulder. You will get injury to your shoulder. Changes in the tissue of your shoulder. I should say changes, not injury. You will get changes in the tissue of your shoulder. You will have an abnormal MRI. And so, if a kid comes to see me with shoulder pain, and I get an MRI, and I have to tell them what the MRI shows. It shows a little rotator cuff damage, not much, okay? Then mom freaks out. Oh my God, my boy's got a rotator cuff injury. He can't play. You know, dad wants him to play through the rotator cuff injury. Kid's completely confused, okay? So we got to be very, very, very cautious when we start thinking about getting MRIs on shoulders and baseball players. Same thing is with Tommy John. So Dr. Andrews always told us, if you want a reason to operate on a baseball pitcher, get an MRI. Because you will see abnormalities on an MRI. And that counts for high school kids too. You definitely don't treat the MRI, we treat the patient. Okay, so there are times when you might get an MRI and the rotator cuff looks crummy. I mean, it just looks awful. The last thing in the world we want to do with that kid is operate on it. Last thing in the world. So we want them to go through physical therapy, non-operative treatment, okay? And so the MRI can be a little bit dangerous. How do we approach the painful and disabled throwing shoulder? With great caution, okay? Throwing shoulders scare us, this surgery. I'll tell you why. So when we think about surgery on the throwing shoulder, it's a salvage procedure, okay? We've tried everything, we've exhausted all the things that we can do, and that kid just can't throw. They've been through 3 months, 6 months of rest, physical therapy, injections, medications, whatever it is, and they can't throw. That's when we start thinking about surgery, when we have no other options left to us. Failed non-operative treatment is the indication for surgery. We go through a typical rehab protocol. So, kid comes in, you're in the middle of season in March, and your shoulder hurts. So we go through this kind of 4-step process of treating that non-operative. We try to reduce their pain and inflammation, strengthening program, advanced strengthening program, and interval throwing program, which is really, really important. Okay, to gradually progress them back to throwing, and then to return to ball. Failure of non-operative treatment is typically a lack of progress after 3 months, and an inability to return to full level of play after 6 months. Okay, so it's an extended period of time we're looking to try to get these kids over there. Okay? So this is why surgery scares us. Okay, so these are results from the best surgeons in the United States of America. Their ability to get kids back to playing baseball after shoulder surgery for this slap repair, 22 to 64%. Okay? Not real good. Article, 57% return to pre-injury level in overhead athletes. Okay? We're not great at fixing shoulders. We can make the tissue better, but that doesn't necessarily mean you can get back to playing baseball. Now, elbows are different. Elbows are very different. Okay. If you have a full thickness rotator cuff here, you're screwed. 8% return back to play. All right. All right, elbow. Let's go through this real quick. So a lot of different injuries that can happen in the elbow. Flexor peroneal strain, so muscle strain. You get a tear of the ulnar collateral ligament. That's Tommy John surgery. We'll spend some time on that. You get a nerve injury. You can get osteophytes in your olecranon. You can get a fracture of your olecranon, a stress fracture of your olecranon. You get loose bodies in your elbow. Medial epicondylitis that occurs in kids, little league elbow. And then you get these cartilage injuries that occur. All right, so the elbow is all in this position. Okay, we talked about the shoulder being at ball release. The elbow is in this abducted external rotated position because there's a huge amount of force that wants to pull the elbow this way. And there's a huge amount of force that's compressing the elbow this way. Okay, so that's the genesis of injuries to the throwing elbow. And this is what happens. So you get this tension on the collateral ligament on the inside of the elbow, and you get compression on the outside of the elbow right there. This is it. This is Tommy John ligament right here. So it sits right on the inside of the elbow right there, and runs from bone to the humerus to the ulna right there. Okay. Whenever a pitcher pitches a baseball competitively, they're reaching the physiologic limits of that ligament. So every time they're pitching, they're almost getting to the point where that ligament will fail. Now, things that keep it from failing are the muscles and their mechanics and things like that. But huge amount of stress to this ligament from baseball pitching, especially. Also, you get muscle injuries. All right. So you can see there's a lot of stress to that elbow. Okay. Now, this guy's a good pitcher. He can wing it, but you can imagine the stress to the elbow right here. Throwing a baseball. Now, what's the perception? So, Tommy John surgery. Everyone here has heard about Tommy John surgery. Okay. What's the public perception of this surgery? So they ask people. So, should Tommy John surgery be performed on players without an elbow injury to enhance performance? Okay. So, 30% of coaches, so almost 1 in 3 of you guys, thinks that it should be done. 37% of parents, 51% of high school kids, and 26% of college athletes. Okay, think that we should be doing surgery to do Tommy John surgery to make them better. Okay. So a lot of misperception about Tommy John surgery and all the violations. I say same thing with elbows as with shoulders. So you get an MRI, you're going to see abnormalities. Okay, I almost never see a good-looking ulnar collateral ligament on an MRI. It's always something in a baseball player. Okay. Decision-making can be pretty complex with Tommy John surgery. There's a lot of things that have to go on. And again, we try non-operative treatment to get people back with Tommy John surgery. Okay. Now, you guys all probably heard that people come back better after Tommy John surgery, right? And probably everyone's heard that. You've heard some issues, and so people do. Okay, so let's take a high school, let's take a college freshman. Okay, so he in high school was throwing 90. Okay, he comes to college, and he's out there throwing 86, 85, 86. He's lost control. We figure out that he needs surgery, so we do Tommy John surgery. Okay, and the kids come back and he's throwing 90, 91, 92. Okay, so why is that? So he's doing better. So one of the issues is that they were injured, so they weren't reaching their maximum potential. Number 2 is, for a lot of these kids, it's the first time, so it's a year to get back. For a lot of these kids, it's the first time they're not throwing baseball year-round since they were 8 or 9 years old. The third thing is that during their rehab process, we're able to work on their shoulder, and their core, and their leg strength. The other thing is we're able to work on their mechanics. Okay? And again, this is the first time a lot of these kids are actually able to sit down with a coach and really go over their biomechanics because they've been too focused on winning and doing whatever it takes to win. Okay? So you do come back better sometimes with Tommy John surgery. It has nothing to do with the ligament. It's the other things that are associated. So same treatment for an injury. There are some really cool things we're doing for all the collateral ligaments. These injections, PRP injections and stem cell injections. So we'll take blood from kids, or we'll take bone out of their hip, and we'll inject it into their damaged elbow. Okay? We've had some pretty good success with that. Doesn't work in everyone, but we try really hard to get these kids better without surgery. Now, that being said, Tommy John surgery is a really good surgery. I approach shoulders very, very cautiously. Elbows, we can be more aggressive. We want to get kids better without surgery, but I can get most kids back, 90% of kids back playing baseball with Tommy John surgery. Okay, and that's across the nation. That's not just me. That's across the nation. So we're pretty good at that surgery, getting kids back to playing after that surgery. This is the surgery we do. We just take a tendon and we drill holes in the bone and weave it through the bone right there and basically build a new ligament. So some results, okay, 79% return to play. These are the guys, Dr. Andrews' group. 1,281 Tommy John surgeries over a period of, I think it was 8 years. All right. 83% return to play. Now, a lot of those are high school kids. High school kids have a little bit lower return rate just because they're high school kids. And you got to question their motivation, or they got a girlfriend, or whatever happens, and they don't come back to playing. But you have to report that. Okay, so in real life, kids who really want to get back to play, it's about 90%. Major league pitchers, it's about an 82% return to play. Now, again, part of that's contracts in professional baseball, and they might not want to renew your contract if you've had surgery. But in people who had Tommy John surgery, there's no change in their ERA, walks, or hits per inning, and innings pitched. Okay, so these guys are coming back from Tommy John surgery doing pretty well at the major league level. Now, what we are seeing is actually some of these players who have had Tommy John surgery, they're starting to fail. So they're 4 years, 5 years, 6 years out, and they're needing a revision of Tommy John surgery. You get injuries to the lecturon, the back, stress fractures, and we have to go put it in the screw to fix that. You get these injuries to the cartilage. I've seen several of these, and we have to fix those. And then this is what happens in kids, okay? We talked about the growth plate in the shoulder. You have a growth plate in the elbow. And you'll see this typically in 12-year-old kids. It's when they're making the transition from Little League base distances to regular base distances. They're overthrown, and they shoot up, they get a little bit stronger, but their body's not able to handle all that, and they yank this bone off the inside of their elbow right there. Happens right there. And we have to go fix it with the screw. That's called Little League elbow. Okay, very common.
Doc, can I ask you a question?
Yeah.
Why is the double Tommy John thing starting to happen now where we didn't hear about it 5 or 6 years ago?
Because there's more of a sample size. So there's a lot more people who have had Tommy John surgery who are coming down the pipe. Okay. Part of it is because we can do it. So in the past, once you had Tommy John surgery and it failed, they just kind of fell away, they withered away. You didn't hear about it. Okay. Now we're actually able to operate on them again and come back again because their techniques are a little bit better and our equipment has changed. Part of it is the velocity that people are throwing the ball. Okay, so when they're 46, right? So when we were younger, there weren't that many guys throwing 95 in Major League Baseball. There just weren't that many. And there are a dime a dozen now throwing 95 in Major League Baseball. And there is only so much stress that this thing can handle. And so, in the past, when guys were throwing 80 or 90 miles per hour, all right, they were like Mustangs, okay? They gave you output, they looked good, they were able to give you innings, okay, they were tough. But now we're making Ferraris. And Ferraris are designed for performance, not designed to last. And so when you're throwing 98 miles per hour, you're just putting more stress on that elbow. And we have a lot more people now throwing 95, 96, 97, 98 miles per hour.
Is there less stress from down here or down to go later?
So, no. All right. Interestingly, no. So, right. We have not found that underhand and sidearm pitching has really changes the force of the elbow. For sure. All right, biomechanics. So, I'll take a different turn here. So, all right, we talked about the baseball pitch, okay? It's a series of stresses to the body, and they're rotational stresses that you're putting on the body, okay? Because you're generating forces from the ground up, okay? Everyone will tell you it's in your legs, it's in your butt, it's in your abdomen where you become a good pitcher, okay? That's absolutely true. So your body has to go through these series of rotational movements, and it starts with the trunk. When you have foot contact, lead foot contact, you'll have your pelvis rotate, your shoulders should still be behind, and then you have this rotation through your trunk, and then you have the rotation through your shoulder and your elbow and your wrist and your fingers. Now what has to happen is you need to be very, very, very efficient in generating those rotations. And if you're not efficient in generating those rotations, you won't be a very effective pitcher. And if you are an effective pitcher and you start having problems like you get hip stiffness or back stiffness, that affects your ability to, in a very coordinated fashion, generate those rotations, you're going to be in trouble. So it's called proximal to distal kinematic sequencing. So basically what that means is you're taking forces from your pelvis, from your abdomen, from your trunk, and you're delivering them out through your shoulder, through your elbow, through your hand to deliver a baseball. So this sequencing is dependent on two things. So it's dependent on muscle strength. It's primarily your core strength, your abdomen, your butt muscles, your quads, your hamstrings, chest muscles, and it's the timing. And that's the key. This is why great pitchers are great pitchers. This is why guys can throw 95 miles per hour, is they time their rotations perfectly in order to generate their forces through their hips, through their pelvis, through their trunk, their chest, through the shoulder, elbow. Okay. So the angular rotation of the pelvis around the spine, angular rotation of the trunk around the spine, and angular rotation of the throwing arm and the shoulder, elbow. That's what makes a great pitcher. So we use golf as an example. So in a golf swing, if you look at golfers, professional golfers, they have a very specific way that they do things. Okay? So when their maximal forces, they'll reach maximal force in their pelvis, then their trunk, then the arms, and then their club. Okay? Because they're rotating in a very specific pattern. Okay. The next slide. So to show pros and amateurs, so these are pros. Okay, it doesn't matter if you're Jim Furyk, who has an awful looking backswing, or Tiger Woods, or any of these guys now. You know, they can come back and their backswings will be crazy, but once they start their swing, they go through this very specific pattern. Okay, these are amateurs. So amateurs are all over the place. You know, this guy, his arms are rotating before his thorax over here. Okay, and that's what makes a bad swing. And you look at it. So look at the velocity, rotational speed of the pro. Look at where these guys' rotation go. Okay, their velocity. That's because they don't know how to time their golf swing. And that's the thing with pitching that's so important. So we look at critical outcomes of the pitching. You look at the delivery of the pitch from first forward movement to foot strike to shoulder squared up to target to ball release. Okay, that should happen in a very specific sequence and pattern. Okay, now I can't look at that with the naked eye and know if they're going through that sequence, and that's why high-speed video has become very, very valuable in looking at these things. You have to go through these patterns. And again, if there's an injury, so if you have a shoulder injury and you can't rotate, you're going to lose your time. If you have a trunk injury and you can't rotate, you're going to lose that time, and that's what kills you. Look at this guy. He's a fat ass. Look at him. I mean, he doesn't look like an athlete, like a guy who should be making millions of dollars. He looks like he ought to be sitting on the sofa eating pizza. All right? It was one of the interesting things I worked with Dr. Andrews. So we had minor league pitcher, major league pitcher going through, and they didn't look like athletes. I mean, they didn't look like, especially Latin athletes. I mean, they didn't look like athletes at all. The pitchers, not the outfielders. Okay. He's a great pitcher, was a great pitcher, because he timed his sequences properly. Right. set up, we look at leg lift, energy angle. Okay, you're talking about forward momentum with leg lift. Okay, so when you're coming down and everyone thinks that you're coming up and you're balancing on that back leg, once pro pitchers start once they lift their leg up, they've started. Their forward momentum's going. And so that's part of the sequencing process that you need. Okay. And there are numbers to back that up. Okay, so you look at the velocity of forward momentum from the first move to foot strike. Look at the differences. So a pro pitcher, they're going 8.71 feet per second. If you look at a high school pitcher, they're 8.45 feet per second. Okay, these guys aren't as good in generating the momentums and the stresses and the rotations as these guys are, and that's why these guys are making money going baseball. You have to have efficient hip-shoulder separation. I'll show you some pictures in a second where we talk a lot about the hips and the rotation of the hips compared to the rotation of the shoulders. Okay, that's very, very important, that hip-shoulder separation. And then stride length efficiency. Okay, the longer your stride length is, in the vast majority of people, the better off you're going to be. Okay, the stride length efficiency is the length of the stride based on height. So the guy who had the best stride length efficiency in Major League Baseball in recent years, Nolan Ryan. Okay, his stride length efficiency was 115%. So he was going 15% more on his leg strike than he was tall. So he had a very, very efficient stride length. Okay, and if you have something that disrupts that, again, it's going to disrupt the whole kinematic sequence process. Talk about maximum external rotation. If you can't generate that external rotation, you're going to get in trouble. There's 4 body movements that contribute positively to ball velocity. These are based on videos and very, very elaborate video testing of baseball players. So your trunk rotation, again, we talked about that hip-shoulder separation. That's where you get your trunk rotation from. Shoulder internal rotation, elbow extension, wrist flexion. Okay, those are the things that, at least on video, have been attributed to maximum velocity. So we need to assess deficiencies in the kinetic chain. This is kind of the big thing that we're doing right now in sports medicine for pitchers. We're looking at range of motion restrictions. What's their hip range of motion like? What's their low back range of motion like? Their thorax range of motion like? What's their shoulder range of motion like? Their elbow range of motion? And we're looking at core strength and weakness, okay? And core strength doesn't mean you have to have a six-pack, okay? Core strength just means that you're strong enough up here to develop those rotations. Okay, so we'll put our USC athletes, our baseball players, through a series of tests, and we're looking at them. So these yellow things are kind of where they're a little bit questionable. These reds are warning signs. We got to watch these guys. So if they get injured, we'll look back and say, all right, well, maybe it was because of their shoulder scaption strength, or maybe it's because of their external rotation strength. And we'll look at those things. Okay. A lot of different tests that you can use to test core strength. All right, so a little bit more of the biomechanics is this inverted W position. You guys have probably heard about this inverted W position. So it's when at foot strike, your elbow is higher than the ball. Okay? And so some really, really good pitchers are going through and they generate this inverted W position. Now this is a really, really good position to develop high forces and rotations, which allows you to throw a baseball. We don't think it's a very good position as far as generation of injuries. All right, so Maddox and Strasburg. Okay, so we'll go through their mechanics here. Obviously, Maddox, one of the greatest pitchers ever, favorite pitcher ever watching. Okay, he's like a surgeon out there. And then you got Strasburg, who's all about power. So when we're going through the windups, you can see that he's already kind of developing different rotations than Maddox is. Okay, and through his hips, they're strong. All right. So when at foot strike here and foot strike here, you'll see where his elbow is basically at or below the level of the ball, and his elbow is above the level of the ball. And you can see the tilt in the trunk right here. His trunk is more straight up. Okay. And this is key. So we talked about that hip-shoulder separation. So if you look at Maddox, his hips are open. He's in an open position right here. his shoulders are still back. So he's generating his rotation through his trunk when he's throwing the baseball. When you look at Strasburg, his hips are closed and his trunk is closed. So when he's rotating, he's not separating his trunks from his shoulder. So where he's getting his velocity from is a rotation in his shoulder and his elbow. So we looked at a couple of our USC pitchers and said, well, is that cold? Okay, is that for real? And so one of the greatest postseason pitchers, one of the greatest college pitchers ever, you can see a quick strike where he is. Look at how open he is with his hips. And look at how closed his shoulders are. Okay? And then one of our other pitchers here, who has required surgery, hips are closed, shoulders are closed. So he's going to rotate that in sequence. That doesn't allow him to generate power through his trunk. So he's generating forces through his shoulder and elbow. And that's going to increase his risk for injury. And then follow. All right, so why do baseball injuries occur? Too much stress. So immediate overuse, so game day overuse, or cumulative overuse. Okay, so overuse over a season or a year. Poor mechanics, body imbalances. Some people have too much strength. Some people have too little strength. Too much strength, coaching, nutrition, body balance, good mechanics. Okay, so all these things play a role in baseball injuries. There's no doubt, we see more injuries these days. And I bet all the coaches who've been around, you're seeing a lot more injuries in youth athletes. We're seeing them in college. We're seeing them in Major League and minor league. Okay. Now, part of that is because we're better able to treat some of them, and we're recognizing them better. But there clearly is something else going on causing these injuries. Okay, coaches. It's an increase in surgeries in younger athletes. I mean, we're operating on some young kids. 13, 14, 15-year-old kids. I've done Tommy John surgery on a couple 14-year-olds. Okay. From 1994 to 99, in 2000 2004, there's a 4 times increase in college pitchers getting elbow surgery, 6 times increase in high school pitchers. We're seeing this in high school age. We're seeing this increased injury in high school kids. Can't tell you how many South Carolina kids I've had to operate on. Okay, this is from 2 years. Pitchers that I've had to operate on. I didn't do his surgery, but he had Tommy John surgery. Okay. So a lot of shoulder and elbow injuries at the college level. I've operated on way too many South Carolina. So why are we seeing the increase in injuries? There's simply more kids playing baseball. Okay, like college sport, a lot of kids playing. So we're going to see more injuries because we've got more kids playing. Increase in the number of organized baseball activities. But this is the key. So increase in instances of injuries per player. Okay, so we're seeing more injuries per player. So why is that? So these are things, so a study, it's one of the best studies that they were looking at why kids get injured and looking at associations with that. Okay? So what we saw was that if you throw a fastball, this is high school level kids, if you throw a fastball over 85 miles per hour, you have a 2.5% increased risk of needing surgery. So these are needs for surgery. So we question whether or not there needs to be radar guns at lower levels. Because kids will throw to the radar gun. If you throw more than 80 pitches a game, there's a 4 times increased risk of needing surgery. If you pitched over 8 months a year, 5 times risk of injury. This is one of the things that we like. We really want kids taking 3 months off from throwing. Really want 3 months. Hard to do in today's environment. So many leagues, year-round baseball. That's really hard to do, and I get it. It's hard. But we really want kids taking 3 months off from throwing. We don't want them taking 3 months off and sitting on the sofa. Right? We want them working out, running, lifting weights, doing core exercises, working on their flexibility. If they're not playing other sports, we would love for them to play other sports. But we really want 3 months off.
Is that throwing or competitive throwing?
So competitive throwing, okay? I don't mind if a kid goes out and throws every once in a while in that 3-month span, but it's competitive. All right, now this is the big ring. Next one. Pitching with RPC. 36 times increased risk of surgery. That's the big thing. If they're fatigued, their mechanics are going to break down. They're going to lose that kinematic sequencing, that efficiency of rotation, and they're going to hurt themselves. Right. These are other things. Taller, heavier pitchers. Well, the taller, heavier pitchers tend to be sometimes they're better pitchers, so they get overused. Plus, they're putting more stress on their elbows. More than 26 warm-up pitches. And kids are using a lot of Motrin. Makes sense. They're hurt more. They need more surgery. Early weightlifting. Not necessarily a good thing. And participation showcases. Those things are all increased risk. So, why do injuries occur in youth sports? Okay, early single sport specialization. We think that's bad. Because you're not allowing your body to cross-train. You're developing a lot of imbalances. All you do is play baseball. You're rotating to the right the whole time. You're completely neglecting your left side. And you're doing it thousands and thousands and thousands and thousands of times. Okay, so we would love for kids to go out and play baseball and then go play football, then go play basketball. Okay? We are quickly coming to the realization that that's not going to happen. Okay? Single sport specialization is here. And it's happening. And we're not going to stop that train. I don't think. And so we need to try to work within the system. Year-round organized competition. You know, that was a great question. You led into this really, really well. Okay. So organized sports year-round are the problem. It's not going in your backyard. Okay. Latin American kids are changing. The Latin American kids didn't get into organized baseball until they were about 16, 17 years old. Okay. And we had Latin American kids coming up who never got hurt. The question is, why were they not getting hurt? In Latin America, they didn't have the organized sports. So organized sports, when I talk about year-round baseball and stresses, it's from organized competition. Now, why is that? Next slide. Organized sports demand. It doesn't matter if you're a church league basketball coach. It doesn't matter if you're a major league coach. It doesn't matter if you're a single A high school coach or a high school coach. It doesn't matter if it's little Susie's softball team. Every coach wants to win. That creates a problem as far as year-round sports. Okay. Winning isn't everything. Why do the pizza work? Next slide. Again, Vince Lombardi. Winning is not a sometime thing. It's an all-the-time thing. You don't win once in a while. You don't do things right once in a while. You do them right all the time. Winning is a habit. Unfortunately, so is losing. And you guys all demand your kids develop that winning attitude. And so when a kid wants to win, and the coach wants to win, and their parents want to win, that kid's going to fight really hard every day. And they're going to stress their body every day. And that's okay for certain things. It's not okay for the shoulder and elbow. You just can't handle that year round. Keep on. So we all want to win. Coaches want to win. Crazy parents want to win. Okay, every kid thinks their kid's going to get a college scholarship. Every parent thinks their kid's awesome. And they're going to push their kids. And push them and push them and push them. So crazy parents are clearly part of the problem. And kids win. Okay, and that's okay. Winning, there's nothing wrong with winning. Everyone wants to win, and we should want to. We just can't demand winning from pitching a baseball 12 months out of the year. That's causing problems. Opportunity to play on multiple teams during the season. Big problem. Okay, a kid goes and pitches for one team, then he goes out the next day and pitches for another team. Well, everyone knows that that's probably not the right thing to do. But you want to win. Kids want to win, the parents want to win, the coaches want to win. And so you get used improperly. And it happens to the good athletes. Okay? You're not putting your bad pitcher out there every day. He's not going to give you a chance to win. You're putting your best kids out there, giving yourself a chance to win. For coaches' physical development, and that kind of went back to what I was talking about before with the Mustang and the Lamborghini. Our kids in high school, when I was coming through high school, you hit 90, holy moly. I mean, you were bringing it. You were bringing it. It's not all that uncommon to see high school kids hit 90 on a gun. That ligament sometimes can't take that. So we're seeing kids throwing faster at a younger age. And part of that's because of you guys do such a great job of coaching them. Nutrition's better, they're stronger, kids are just physically better developed now than they were 20 years ago, 30 years ago. Inadequate coaching. Okay, keep going. All right. And so overuse, okay, we're talking about that. Overload can occur, again, and too many pitches in a game, too many pitches in a week, too many pitches in a season. Okay, and it's this cumulative effect that builds up over time. Okay. If I got a college kid, if I got a USC kid who needs Tommy John surgery, he didn't start that ligament tearing when he got to college. That started the senior in high school, junior year of high school. And everyone's different. There are some people who can throw 95 miles per hour for 20 years and never have a problem. And there are some that throw 95 miles per hour 2 years and they blow out their leg. So everyone's a little different. So just a little history of overuse. The first modern baseball game was in 1846. They threw underhand then. The overhand pitch was allowed in 1884. This guy named Luck, Dr. Luck, in 1887. Okay, so he wrote an article and he described the mechanics of up curve, drop curve, screwballs, curveballs, and muscles and ligaments involved. This is a long time ago. So this is a quote. I feel quite certain that much of the soreness is due to accumulated excrementitious products, the result of sudden transient and excessive function activity. Okay? So basically overuse. In 1888, he talked about something treating of this subject is now urgently needed, is amply shown by the large army of disabled players, especially pitchers. So overuse is a problem back in 1888. So, for example, back in 1884 to 1892, when he was looking at this stuff, 69 pitchers threw approximately 389 innings per year. Modern professional pitchers throw 140 to 268 innings a year. And that's a lot. All right. How many of those people do you think survived? 79% of them suffered significant injury within 5 years of baseball. It's the number one risk factor for injuries, you guys remember? So this is a problem. And I was sitting down at dinner with one of your coaches the other day, and you need to be tough. In order to play sports, you need to be tough. You need to put your body out on the line, and you need to give it your all. But when you're talking about the shoulder and the elbow, you need to be smart. And if you go out to the mound and your kid says, I'm tired, he should be out. Don't ask him to be tough. Take him out, because he's going to hurt this kid. All right, keep going. Again, fatigue is the amount of work performed, number of pitches or intensive pitches per game, per week, per season, per career. Okay. And inadequate rest. And in baseball, we're talking about rest between pitching and things. Certainly occurs from breakdown in the kinetic chain and biomechanics. Inadequate conditioning, okay, and injury can all result in fatigue or fatigue can cause this. All right. In baseball, they use things like pitcher abuse points or PAP. They'll take their pitch count minus 100 cubic. Okay, so there are a lot of different methods that Major League Baseball uses to look at whether or not their pitchers are working. Improper teach. So from a coaching's perspective, okay, where injuries can occur is overuse. Improper teaching of biomechanics. A failure to account for individuality and physical skills of athletes. Every athlete's different. Some athletes will get fatigued after throwing 2 innings. Some athletes will get fatigued after throwing 15 innings. You need to know your pitchers and you need to know them individually, what they can do, what can't do. Failure to account for mental skills. Some kids are tough, some aren't. You need to know that. Inadequate strength and conditioning. And again, we're doing a better job to a certain extent, medical care, that we're aware of injuries more, and that's part of why we're safety training. College scholarships, okay? Every parent thinks their kid's going to get a college scholarship. Not necessarily the best thing for the kids. So recommendations, avoid pitching with arm fatigue or pain. Number one thing I can tell you, please, please, please don't let your kids throw with arm fatigue or elbow. Avoid pitching too much, no more than 8 pitches a game, no more than 8 to 9 months a year, no more than 2,500 pitches in competition in a year. Very, very difficult. A lot of you guys coach travel teams, a lot of guys coach showcases, okay? I would put the expectation on all of you guys to know what your kids are doing in the other league. Is that easy to do? Nope. Does that challenge you? Absolutely. But I would hope that you would know that. So monitor pitchers. If kids using Motrin all the time, if they got a big jug of Motrin in their bag and they're popping Motrin all the time, probably a sign that something's wrong. Regular starting pitchers get hurt more than relievers. That's because these are your better pitchers than you use them for. Velocity over 85 miles per hour, taller, heavier pitchers, excessive warm-up, showcase participation. So what do we want? We want our kids to perform regular rotator cuff and scapular stabilizing exercises. Okay, we talked earlier about the importance of the scapula. Kids should be doing exercises to work on that scapula, to work on their rotator cuff muscles, to strengthen those muscles to avoid it. Core exercises, again, that's kind of the hot topic right now. Vanderbilt, very, very good college baseball program. They're kind of the leaders in this core strength. And Vanderbilt, their pitchers have very, very low injury rates. Part of it's because they're getting really, really good athletes and really, really good kids. But they also have a really good program of assessing core strength and working on core strength. So core is important. Work on the abdomen, work on the low back, work on your glutes, your quads, your hamstrings, okay? Core is important. So the most important aspect of training for an athlete, this goes a little bit to weightlifting, okay? In pitchers, the most important thing in weight training is injury prevention. It's not allowing your kids to get hurt or preventing them from getting hurt, okay? You don't want your pitchers doing heavy bench press. It's not doing them any good. You don't want your pitchers doing, heavy cleans and things like that. Now, do they need to lift weights? Yes. But you need to know how they need to lift weights properly. Okay? Your football strength coaches aren't necessarily the best baseball strength coaches out there. And so that's a big part of it. The entire program should be geared towards injury prevention. You want your kids strong but loose. You want your pitchers strong but loose. All right, keep going. And this basically talks about what we do post-throwing workout. When do you do a post-throwing workout? Well, if they've thrown less than 25 pitches, do shoulder work and flexibility. 25 to 75% pitchers, maybe some shoulder work, definitely flexibility. If they throw over 75 pitches, no shoulder work, and just work on conditioning. The day after, if you're a starter, you're lifting condition and you do interval work. If you're a reliever, less than 25 pitches, you're ready to pitch. If they've thrown 25 to 75% pitches, check with your pitching coach. Maybe do a light shoulder workout after they pitch. Scapular work, okay, different exercises for the scapula. Rotator cuff, different exercises for the rotator cuff. Arm care, the next one, we're running out of time. Next one. Flexibility is really, really, really important. Okay, really important. None of us do enough of it. Stretching their hips, stretching their back, stretching their shoulders. It's really, really important to work on flexibility. Again, pitches. Keep going. All right. So I think I've run out of time. So, any questions?
I got one. I know you didn't really mention it, but is there any more stress to the elbows on curveballs to fastballs?
Yeah, that's a good question. I'm going to tell you something that I'm not supposed to tell you. So there was a study, and again, we look at studies and science and all that. So there were studies that came out that showed clearly the curveball puts more stresses on the elbow and increases your risk for injury. There have been some studies recently that refute that a little bit. But I would tell you that it's very clear in our world in science and biomechanics that if you start throwing breaking pitches too early, it increases your risk for injury. So a rule that Dr. Andrews uses is you shouldn't be throwing curveballs until you can shake them. Because then you've got testosterone in your system, you build up your muscle strength, and your body can handle throwing a curveball or a slider or whatever. No one probably utilizes that, but that's what we like to see. And the most important thing is pitching is location. Location, location, location. That's what's in the best. All right, what else?
Weight training, pitch, heavy pitch, and cleans, what about overhead lifts like military press?
Nothing heavy. And again, we're talking about pitchers, okay? Your outfielders, all that kind of stuff. Let them go after it. As long as they don't have any shoulder, elbow injuries, whatever, let them go after it. You don't have heavy weights, so you can't go too big. Pitchers, overhead works fine, but low weight, high repetitions.
Going back to the 3-month thing, does it need to be 3 straight months, or can you split that up?
3 straight months.
Three, a lot of hand position, pitching,
Yeah.
straight down. Back to the second base, wall, reference on that.
No. So there's not much that we see with regards to hand position that changes the stresses on the shoulder and elbow that would lead to problems. All right. Thank you very much.